Hello, Las Vegas. Happy Friday. This is Dr. Cindy Duke, and welcome to a special edition of our live program. Today, I just wanted to touch base and to talk about something that's happening across the country. So before we get started, to formally introduce myself for those who may not know who I am Dr. Cindy Duke, medical director and physician here at the Nevada Fertility Institute in Las Vegas, Nevada. I am a board certified obstetrics and gynecology physician, as well as a subspecialty trained reproductive endocrinologist and infertility specialist. Those titles actually mean that I see women and other couples interested in becoming parents, but I also see people who are early in pregnancy, people who have worked very hard to get pregnant, and certainly folks for whom planning for pregnancy is really important. And so I wanted to talk today about the flu epidemic, in part because, as you've probably seen in the news, the flu virus is here. It is spreading. It is dangerous. And most importantly, it's deadly. We're actually seeing some pretty striking numbers coming out from, at this point, 49 different states within the United States of America have reported cases of the flu virus and reported cases of poor outcomes in multiple states. The flu can affect anyone. It can affect an adult, it can affect children, it can certainly affect pregnant women, and we will talk more closely and in more detail about that shortly. But it's worth knowing about it. So today, again, we're talking about the flu, specifically talking about pregnancy, what you should know about the flu if you are potentially planning to be pregnant, if you are pregnant, if you are someone who has a newborn and taking care of either yourself or someone around you who may be ill with the flu. So first question that most people like to ask about is, what is the flu? And so first things first is to know that the word flu, F-L-U, is an abbreviation, okay? So flu is an abbreviated form of the word for influenza. Influenza is actually a virus. It is a virus that usually comes in two types, influenza type A and type B. It's a virus that's spread via usually the respiratory route, which means the way you contract influenza or the flu is from having contact with someone who maybe they're coughing. It could be transmitted in respiratory droplets, so close spaces, close contact, and it causes infections of mucosal membrane. So, respiratory infections, your nose, your chest. It can cause a stomach infection. But the real key that I want to make sure everybody is keeping in mind is because sometimes people confuse the flu for something else. And that is because for a lot of us, when we hear flu, we use that word interchangeably with a cold, but they're very different. So the flu is an infection that you get from a virus known as influenza, whereas a cold is a common cold. A cold is something that you can contract. Colds are very common. It's a very different family of viruses. The viruses that cause colds, the common colds, those are known as coronaviruses. They're very different from influenza. They work differently, and certainly the impact that they have on your body and the destructive nature of them is very different. And so whereas, for example, with a common cold, you're taught to do what we call supportive measures, monitor your temperatures, take care of your fevers, hydrate, etc. With the flu, there are actually medications, prescriptions that treat and block the virus. And we'll get into that a little bit more as well. But I really want to make sure that everybody understands there is a difference between the flu and the common cold. And it's not just, one is a milder version of the other. No. They're separate and they're different. The flu, influenza, has been around for a while. I'm bringing that up because there are a number of commentaries that are out there in the news, etc. And there are people who are like, oh, we've had flu for eternity, and people that, this is a marketing strategy by pharmacists and doctors and pharmaceutical industries to scare people about the flu. But that is in fact not true. The flu has been around for a long time. As a matter of fact, exactly 100 years ago, in 1918, the influenza virus actually caused what is known as a pandemic, meaning that virus, that particular strain of the flu, it was very deadly. It spread around the world, and over 1 million people died as a result of the flu of 1918, exactly 100 years ago. And so, guys, this is serious. The flu is serious. And if we don't take precautions, if we're not safe about it, not only is it going to continue spreading in this season, but recognize that flu viruses can be deadly and they can spread around the world. And so it's really important that we talk about this. It's what drove me to talk about this. And it's what drove me to want to talk about this as it relates to people planning pregnancy, because it can impact someone who is early in their pregnancy or later, and certainly it can impact the rest of your family if you're exposed, or vice versa. And so those are the key things to remember even right now. As we talk some more, let's go on to talk about, so we've said that it's a virus. It infects respiratory or mucosal surfaces, so like your nasal area, your throat, your chest. You can have a stomach type of the flu, stomach infection. The flu can range in symptoms from something as simple as body aches, fevers, to having severe fevers in the high range, greater than 103.5 degrees Fahrenheit, for example. It can range to where someone, depending on their own health status, it can land them in the hospital. It can land them in the intensive care unit, meaning unconscious, unable to breathe on your own, requiring the aid of breathing tubes, requiring a ventilator or a breathing machine to help you breathe. That's how severe the flu, influenza, can be. So the question that a lot of people ask is, yeah, but I've had the flu before and I do fine. I've had the flu before, no problem. Well, chances are you may or may not have had the flu. The truth is, if someone thinks they've had the flu, they should be evaluated and tested. There is actually a test for the flu. There is a test that can be done to check if you have been infected by influenza A or influenza B, the two types of flu viruses. If you tested negative, then you probably weren't having infection, signs and symptoms of a flu infection, but rather maybe more of a common cold or one of those other respiratory viral infections. But if you have the flu is very contagious. It can spread very quickly, especially if you're someone who's not practicing some of the basic respiratory hygiene practices that are recommended if someone has the flu. Now, these recommendations are also good for people who are trying to avoid the flu. The first thing in terms of hygiene is always washing your hands. Always washing your hands. If you were to cough, don't cough into your hands, but cough into your sleeve. If you have a sneeze, make sure you clean and dispose of what you've sneezed with, and quickly clean your hands with either soap and water. If you're using soap and water, you really want to lather up your hands, lather up between your fingers, and wash and rinse for at least 10 to 15 seconds, right? So lather up. Count of 10, 1 and 2 and 3, at least a count of 10, really lather up completely, thoroughly, and rinse. If you don't have access to soap and water, if you have access to the Purell gels or one of the alcohol-based sanitizing gels, you should be using those. These are definitely ways to help reduce the spread. If you have active flu symptoms, you should ideally wear a mask wherein you block the transmission of particles that can transmit those virus, the flu virus. Certainly, if you think you have the flu, most importantly is try to avoid going out and spreading it further. Now, that doesn't mean you shouldn't go see your doctor, but if you need to see your doctor, do please be mindful of it. Call up the clinic ahead of time, or if you have to go to urgent care, then when you get there, be sure to mention why you're there, so that they can take the necessary precautions, which would mean putting a mask on you, the person who's suspected of the flu or suspects they have the flu. I say this importantly because I've had a few incidences where patients who thought they had the flu have shown up to the office and said to the staff, "Oh, you guys should wear protection. I think I have the flu." And that's not how that's supposed to work. If you think you have the flu, you should be the one wearing a mask, etc., to try to protect others from it if you can. Okay? So it's not that everybody else should wear a mask to avoid you spreading it to them. You should actually wear the mask to avoid spreading it to others. Okay? So that's a key distinction to make if you're considering that maybe you have the flu, or maybe you need to go get evaluated. If you have access to, you try to minimize the exposure of yourself to others. If you had to go out, you try to minimize how you expose others by wearing a mask, etc. Certainly, there's many clinics that can actually offer diagnostic services via what we call telemedicine services. And so this suspicion of the flu is a good way to maybe contact first and discuss via telehealth service how to get treated. And then they can assess you initially and determine whether you need to come into the office or whether you need to go see urgent care or whether you needed to go to the emergency room. Now, if you're someone who also has underlying illnesses such as asthma, other lung disease, COPD, etc., you are considered to be at increased risk for contracting the flu virus. If you're someone who is immunocompromised, such as someone who's maybe getting treatment for cancer, who's getting chemotherapy, who's maybe on long-term steroids for different diseases, then you should also consider yourself high risk for contracting the flu. Other people who are considered high risk are pregnant women, and that's in any stage of pregnancy. You're considered to be high risk for influenza virus infection. And young children of all ages, but especially young children. And this is all why actually you're recommended to have a flu vaccine if you can. And when I say if you can, I mean because you should. And we'll talk a little bit about the flu vaccine. Now, I know there are lots of misconceptions out there about the flu vaccine. For one, many people hear and say it doesn't work. The flu vaccine does not work. Oh, the flu vaccine, I took the vaccine and I got sick. So let's clarify some of those. The first thing to know about the flu vaccine is that there are different forms of the flu vaccine out there. There's one form known as the live attenuated flu vaccine. Live attenuated means that it's a vaccine made up of different parts, different versions of the flu virus, but they're actually alive. So they're weakened, but they're still capable of causing a low-grade flu infection. So that's the live attenuated flu vaccine. It's usually administered nasally, so it's like a nasal spray, and that's the live vaccine. The people for whom are recommended to get the live vaccine are people who are not within the high-risk groups that I just described. So for example, if you have a history of asthma, you're not really offered the live attenuated vaccine. If you have a history of autoimmune disease or other immunocompromised states, cancer, HIV, if you're pregnant, if you're a young child, you're not given the live attenuated vaccine. That's the first thing. But the distinction to understand here is with that live attenuated flu vaccine, you actually will get a low-grade flu infection. That is how it works. The intent of the live attenuated flu vaccine is that you get a weakened version of the flu virus so that your body mounts an immune response to that infection that your body just saw from the vaccine. And thus you then build immunity to the vaccine. And as a result, if you are later exposed to the real full strength version of the vaccine, you've been vaccinated. You've now immunized yourself to it. Now, the purpose of a vaccine, let's talk about that for a minute, because I think there is a lot of misinformation out there about the purpose of vaccines in general. And for certain, as a result of that, now we're seeing the deaths that we're seeing. And I'll tell you what I mean by that in a few seconds. A vaccine is meant to either prevent infection or weaken the effect or impact of an otherwise very virulent, deadly, or dangerous infection. So note that a vaccine does not mean it's supposed to prevent completely someone from catching something later on, but it's meant to prime your body. So your body now knows how to recognize certain infections, and it can prevent them from really going on to become bad infections when you finally see it. So a vaccine, basically, if you think about it, is the training for your body that it needs so that when it sees the real threat, it knows what to do. And that's what the live attenuated flu vaccine is, right? And so, yes, if you got that type of the vaccine, you will get a low-grade flu infection. That is expected. It's the way it works. It's how it's designed. It's the same as if you got the vaccine for the measles, mumps, rubella. Those are live attenuated vaccines. If you got the vaccine for shingles or chickenpox, it works the same way. Those are live attenuated viral vaccines. They work by giving you a weakened form of the infection so that your body knows how to fight it off, so that in the future, if you were exposed to the real strong version of that virus, your body's ready. The systems are ready, the soldiers in your body know the threat, they recognize the threat because they've seen it before, and they can go after it. But there's another type of vaccine, and that is known as the inactivated flu vaccine. Inactivated flu vaccine means that it is not live or attenuated. So the word live obviously means a live virus. Attenuated is a fancy medical term for weakened. So the live attenuated vaccine is a weakened form of the vaccine, the flu virus. But in the inactivated form, there is no live virus. So it's not attenuated, it's just not live. There is no active virus in the inactive vaccine. It's actually what we call a subunit vaccine, meaning it just has some proteins that are from the flu virus, and they take it from a number of different strains, different proteins, and they create this combination known as the flu inactivated vaccine or the subunit vaccine. And that is the one that's given via injection to the majority of people who fall into the high-risk groups. So for example, if you have a history of asthma, history of COPD, like I said, history of lung disease, or you're autoimmune or otherwise immunocompromised, such as cancer or HIV, history of HIV infection. If you are a young child, they give them the inactivated form of the vaccine, and that's known as the injection, and it's the subunit vaccine. Within that class of subunit vaccines, there's another special class. There's one that has absence of mercury. Mercury is usually a subunit in many, an ingredient in a lot of these vaccines, mercury and aluminum. But there's one that lacks all of that, and that is the one that we give to patients who are planning or may be pregnant. So for pregnant patients, there's a very special type of flu vaccine out there for you. It's the reason why if you showed up asking for a flu vaccine, you are asked, could you be pregnant? And certainly if you are at an OBGYN clinic or any doctor's office, they actually do a quick urine pregnancy test to verify that you're not in fact pregnant at the time that they're planning to. But I can tell you for sure, if you go to, say, your OBGYN clinic, they only have the vaccine that does not have mercury or any of those other ingredients in there, because we assume that a patient could possibly be pregnant anytime coming up. So it's not a matter of giving you live versus not, or the one with or thimerosal or not. You do not get it. You get a special one that's designed for pregnant women. The vaccine is safe, guys. It really is. It's safe, and I'll explain why it's safe. Vaccines have to be designed a certain way. They have to go through very rigorous versions of testing and verification and validation. A lot of the myths that are out there about vaccines they're just that, guys. They're myths. They're not based on any science. They're not based on truth. And they're meant to scare people into doing things that are actually ultimately unsafe for you, the person, and for those around you. Now, the flu vaccine, every year, the flu vaccine that's given here in the United States and most of the Western world is based on what's known as predictive strains. So they look at what are the circulating strains of the virus around the world right now, and then they make vaccines based on what seem to be the known strains that are infecting people at the moment. And so they can be very close or very effective, or they may be not very close to the virus that's circulating right now. But I will tell you this, there have been countless big studies that have been done that looked at what happens if someone's been vaccinated for the flu and they're exposed to a virus that's a flu virus, but not exactly one that's included in the vaccine that they got. And across the board, what they saw was that if you got the flu vaccine, even if it wasn't exactly close to the actual virus your body ultimately became exposed to, having received the vaccine helps your body know how to fight off the virus completely or in part. And that brings me to the next big point here, which is of the deaths which have been occurring in the United States right now, the deaths from flu that are occurring, in these cases, these people or children all were not vaccinated. These have been happening in people who were not vaccinated. And so it's important to understand what that means. It means that people are getting infected by the flu virus, but the ones who are being hardest hit are the ones who did not get their vaccines, guys. So we've got to pay attention to that, okay? I want you guys to really take off the blinders and look at the news, look at the stories, and understand what we're talking about here with the flu. The flu is and can be dangerous. It can be deadly, but it also can be either prevented via a combination of healthy hygienic practices, such as hand washing, cleaning your hands, coughing or sneezing into your sleeve, not into your hand palms, cleaning your hands right after you cough, etc., washing well with soap and water, wearing a mask if you think you are potentially infected. And certainly some people just wear a mask to avoid others. They just don't want to risk being infected by others, meaning they're not infected, but they're avoiding it. But understand that if you received the flu vaccine and became unfortunate enough to be exposed to the virus, having had the vaccine immediately decreases the severity of the type of flu illness you will get. So there is benefit to it. Even if it didn't prevent you from getting the flu, it helps you recover sooner, and it helps to keep you out of the intensive care unit, guys. It keeps you out of that or worse. It's important to note that. We'll talk a little bit more about strategies for treating the flu once you've been diagnosed with it in a second, but I just want to answer some questions. So we have one here from Lorelei. Hi, Lorelei. Happy Friday, TGIF. She says, I've never had the flu vaccine. That's true. I know there are many people out there who've never had the vaccine. But what I would say is this. If you're considering pregnancy, you should. We highly counsel you to go get the vaccine. Okay? So if you are planning pregnancy, I highly recommend you get the flu vaccine. Specifically, let them know that you're planning to be pregnant, and they will give you the vaccine that is specific for pregnant women, meaning it's the one that does not have things like thimerosal, etc., which are certain components or ingredients that are excluded from the vaccine because you're pregnant, because those things can cause problems, so we don't include them for women who are planning to be or are pregnant. Important to know, if you are planning to get the flu vaccine and you forgot and now you're pregnant, you still can get it, guys. You can get it. You just have to let them know you're pregnant and they'll give you the right ones. If they don't have it there, they will direct you to where you should go. The next question, we have a message and it says, I understood vaccines are behind from current virus, so not effective in kids or adults. And the important thing to hear about this is what I was just talking about. So the way they design the vaccine for any given year is they look at the strains, they look around the world. Because the truth is, as we all know, right, we worry about flu around fall, winter, early spring. In the United States, when that's happening, other places are just coming off of their fall, winter, spring. And so they look at those other parts of the world to see what were the circulating viruses. They look at different continents to see what seems to be the prevalent virus this year in that country. And then they prepare a vaccine cocktail based on the prevalent strains to combine them so that they can give a vaccine. Now that's known as predictive modeling. So they're using some predictions based on what they're seeing elsewhere, what they've seen in the past few years, what was the prevalent or most common strains of the flu being diagnosed here in the US and around the world, and then they create the vaccine from that. So it may not always match the exact particular strain of flu that you're exposed to, but what it will do is if your body's immune system has seen anything close to it, which is how vaccines work, it's now prepared to at least start fending off itself from that infection when it sees it. And that is the reason why, even if someone has had the vaccine and does end up getting the flu, they do better than someone who never got the vaccine and got the flu. And so I don't know about you guys, but for me, I know that means I want that vaccine. I'd like to reduce my chances of critical illness and death. And certainly it's why it's recommended for children as well. And so it's not that it's not effective in kids, meaning it does not work at all. It's more that the strains that are present in the vaccine may or may not match exactly the particular virus that you become infected with. But if you've gotten the vaccine, and I'm telling you guys, vaccines are safe, and I'm not just saying that, we can go into an exhaustive panel of questions and data to show that. It's safe. It's safe for children. There are special forms of the vaccine that they give to children. Unfortunately, there's a lot of information out there that's combined a lot of mistruths into one story that's being circulated, but it's not a true story. It is not a true story. As someone who's seen patients, pregnant patients in the intensive care unit from the flu, I can tell you that if you contracted the flu, and you became pregnant or were pregnant, it can be really bad for you. And I'm not just saying that. We've seen some of the worst outcomes there are from women who are pregnant, who got the flu and unfortunately had not previously been immunized. So that's important. But now let's go on to talk about what happens if you got the flu. So you are diagnosed with the flu, what happens? Well, certainly I recommend if you've been diagnosed with the flu, stay home. Okay, you don't need to be a hero and go into work and show up at work or go to the party, etc. Stay home. The first few days, the first 72 to 96 hours of flu virus infection are actually really, really contagious. So it's important if you think you have the flu that you stay home. Okay, stay home. But the other is, I mean, aside from seeking treatment, of course, seek treatment, but I mean stay home. Don't go to work. If your kid's been diagnosed with the flu, be a good stalwart and keep that child at home. I know sometimes childcare can be an issue, but try your best to figure out a way. Follow the doctor's instructions, your pediatrician's instructions, and then once your child has been cleared, you can send them back to school. But here are the big things about treatment, right? Remember I told you earlier on, there is treatment for the flu, prescribed treatment for the flu, whereas for a common cold, you don't need antibiotics, you don't need any special medication for the cold, a common cold, but for the flu, there's actually a special medication to treat it. It's known as Tamiflu, okay? T as in Tom, AMIFLU, Tamiflu. That is the treatment for the flu. So if you have been infected, it used to be, we'll say that you only could get Tamiflu if you're within the first 24 to 72 hours of having been infected by the virus. But those guidelines have changed, and now you can be treated with Tamiflu at any point with it. And what Tamiflu does is it helps to stop the virus from spreading within your body. It helps to protect you as your body starts fighting the virus and healing itself. But most importantly, the way it works is it shortens the duration of the illness, okay? So getting treated with Tamiflu helps to shorten the duration of the flu illness. And why is that important? Well, if you're someone who gets a really bad strain, virulent or really, effectively critical strain of the virus, the flu can knock you down. You can be out for as little as a week and up to a month. You can be out of work, you can be out of school, you can really be hit hard. And of course, for some of our more unfortunate members of society, it can land you in the hospital, it can land you in the intensive care unit, it can land you on a ventilator, meaning a machine that helps you breathe. And most unfortunate, it can potentially be fatal. It can cost you your life. And so that's the treatment for the cold. But now I want to talk about specific things you do. Let's say you maybe think you've been exposed, but you're not sure. So what should you do if you think you've been exposed? Well, for example, for my patients who are planning pregnancy or who are pregnant, let's say maybe you're a mom already, so you have secondary infertility or no infertility at all, you're just planning a new pregnancy. If your child in the home has been diagnosed with the flu, for example, and you're the caregiver or a spouse or a parent's been diagnosed with the flu, you too should receive Tamiflu treatment, okay? And so if someone in your household has been exposed or is actually diagnosed with the flu, then while you're caring for them and they're being given treatment for the flu, so should you. Okay, and that's important to know. So if you're a caretaker of someone who has been diagnosed with the flu, then you too should get your treatment. That's called prophylactic treatment, and your doctor will assess you and prescribe it as needed. So if you've been exposed, that's one way to work on that. Other than that, I really just wanted to be able to talk to everybody to say, don't be too scared. Yes, the flu virus is around. Yes, we have to take precautions, but the biggest precautions we can take are what we call those preventive measures, meaning good hygiene, staying at home if you think you have symptoms, contacting your healthcare provider, getting on treatment once they've made the appropriate diagnosis. If you are not yet vaccinated, strongly consider getting that vaccine, guys. Get vaccinated. I can't stress enough the value of being vaccinated against the flu. Recognize again, like I said, a vaccine doesn't mean it's meant only to prevent the illness. A vaccine also helps by shortening the duration of the illness and weakening the severity of the illness. So I really want to help you understand that it's not simply about, oh, I got the flu vaccine and I still got the flu anyway. That's expected. When you get the flu vaccine, the expectation was never, at least in terms of your healthcare providers, the thought was never that if you got the flu vaccine, everybody then will never get the flu virus. It was more meant so that if you got the flu virus and you've been vaccinated, the illness is weakened, it's not as severe, and therefore you're able to get better sooner. You're able to avoid landing yourself in the hospital or in the intensive care unit. And more importantly, you can get on with the things that matter to you in life by recovering faster. And so please consider getting the flu vaccine. The flu vaccine, there are different types, like I talk about. The key things for women planning pregnancy or already are pregnant is you should know that there's a special type of flu vaccine out there for you. The only people for whom they may not be eligible to get the flu vaccine are people who have a genuine allergy to eggs. Meaning if you're someone who, if you are exposed to eggs, you get, your throat closes up, you can't breathe, etc., what's known as anaphylaxis, then you may not be a candidate for the flu vaccine. That's because the flu vaccine, at least the subunit ones, the ones that we give to patients like pregnant patients, etc., those are actually grown in eggs. And so that's why you're asked that question. Are you allergic to eggs? But you know what? If everyone out there who is eligible for the flu vaccine got their vaccine, they can help protect the people who are ineligible for getting the vaccine due to that severe allergy to eggs. And so it's really important that we take care of each other. Okay, I don't want to go on too much longer. Thank you guys so much for tuning into this special edition. If you have more questions, I will be available to answer them offline. So go ahead and shoot us your questions, shoot us your messages, and I'd be happy to answer your questions, concerns regarding the flu and pregnancy. I didn't actually tell you what happens with flu if you got pregnant, aside from landing you in the hospital. But if you got a really bad flu infection, it could potentially lead to miscarriage. It could also potentially lead to changes within the placenta and blood flow to the placenta, such that your baby doesn't grow as well. So it becomes what we call intrauterine growth restricted. Any viral infection can really start that process. And so it's important to try to avoid those things as best we can when we can. And lastly, guys, the flu is not a cold, and likewise, a cold is not a flu. There are different viruses. One is the cold virus or coronavirus. The other is flu or influenza. Very different things, very deadly, one of them compared to the other, and thus treated very differently. Okay, so take care. Happy Friday. Happy weekend. I'm actually wearing red because it's Go Red for Women Day in honor of International Cardiac Health for Women Awareness and Recognition. This is International Heart Health Month. And so everyone at my clinic here, we wore red today, and we really do want to talk about that, and we'll do that later this month, about the impact of heart health and having a healthy heart, even when planning pregnancy. Okay, guys, bye-bye and good night.